This video is for educational purposes only and is not intended to diagnose, treat, or cure any illness. Always consult a licensed healthcare provider before making changes to your treatment plan. Rooted in Research Health is committed to providing research-based information, not medical advice. Pneumonia is one of the deadliest infections facing the elderly today. It's more than a seasonal cold gone wrong. It's a life-threatening condition that leads to hospitalization, long-term complications, and in many cases, death. According to global health data, pneumonia causes more deaths in people over 65 than almost any other infectious disease. In long-term care facilities, the risks are even higher, with close quarters, weakened immune systems, and constant exposure to pathogens making outbreaks all too common. Even with flu shots and pneumococcal vaccines, pneumonia continues to challenge healthcare systems. And while antibiotics remain the standard response, we're seeing an alarming rise in antibiotic resistance, leaving many physicians scrambling for safer, long-term prevention strategies. This is why a 2024 clinical trial out of Taiwan is attracting so much attention. Instead of creating a new drug, researchers looked to the past and asked whether traditional Chinese herbal medicine could hold the key to reducing pneumonia in the elderly. They focused on a formula called BDT1, built from two classic Chinese herbal remedies, Banxia Houpo Tang and Chuan Tang. These formulas have been used for hundreds of years to treat respiratory distress, chronic cough, and phlegm buildup. But this time, the treatment wasn't folklore. It was tested under modern scientific standards. The study was conducted using a randomized, double-blind, placebo-controlled trial. In the world of clinical research, that's the gold standard, designed to eliminate bias and ensure statistical reliability. A total of 160 residents from multiple nursing homes were enrolled. All were over the age of 65, and all were considered at high risk for developing pneumonia, based on their medical history, immune status, and living conditions. Participants were randomly divided into two groups. One group received a daily dose of the herbal formula BDT1. The other received a placebo that matched in appearance and dosing schedule. Both groups continued with their usual medications and medical supervision. The treatment lasted 12 weeks, and the researchers followed up for an additional 6 months. During that time, they tracked the number of participants who were hospitalized due to pneumonia. They also collected sputum samples to test bacterial changes in the respiratory tract and monitored vital organs like the liver and kidneys to make sure the herbs were safe. Now, here's where things get interesting. In the placebo group, 34.2% of patients were hospitalized with pneumonia during the follow-up period. In the group that received BDT1, only 10% were hospitalized. That's not a minor difference. That's a 70% reduction in pneumonia-related hospitalizations. The data showed an adjusted hazard ratio of 0.422, meaning patients who took BDT1 had less than half the risk of pneumonia-related hospitalization compared to those who did not. But it wasn't just the outcome that impressed researchers, it was the safety profile. Throughout the study, liver and kidney function markers were monitored regularly. No adverse effects were reported in either group, and no participant had to discontinue due to side effects. That makes this formula not only effective, but remarkably safe, even for frail elderly patients. Now let's take a moment to understand what's actually in BDT1. The formula is a combination of two traditional Chinese herbal blends. The first is Banxia Houpo Tang. used historically for clearing phlegm obstruction and qi stagnation. While those terms come from traditional Chinese medicine, in modern terms, we can associate them with mucus buildup, throat constriction, and upper respiratory tension. Banxia Houpo Tang contains 5 core ingredients. Pinellia ternata, known for reducing phlegm. Magnolia bark, used to relieve chest tightness. Perilla leaf, which may help reduce cough reflex. Perea mushroom, used to reduce fluid buildup. And fresh ginger, a natural anti-inflammatory and warming herb. Combined, this formula is often used for people with chronic throat clearing, post-nasal drip, and tightness in the chest. The second half of BDT1 is Ding Chuan Tang, a formula typically used for wheezing, asthma, and lingering bronchitis. This blend includes herbs like ephedra, bitter apricot seed, ginkgo, mulberry bark, and licorice root. The traditional goal: to restore smooth, unlabored breathing while helping the lungs expel stubborn phlegm. Together, these two formulas target both the upper and lower respiratory tracts. They reduce inflammation, support expectoration of mucus, calm the airways, and may reduce bacterial overgrowth, all of which are relevant in pneumonia prevention. What's fascinating is how these ancient herbal concepts align with modern medical concerns. In pneumonia, inflammation in the lungs leads to fluid buildup, impaired oxygen exchange, and vulnerability to bacterial invasion. Reducing mucus, calming inflammation, and promoting clearer airflow can theoretically reduce these risks. And according to this study, it works. But how do we know this wasn't a fluke? That's where the sputum analysis comes in. Sputum samples from both groups were tested for bacterial content. Specifically, researchers were looking at gram-negative bacilli, a group of bacteria commonly implicated in hospital-acquired pneumonia. The results showed a statistically significant drop in these bacteria in the BDT1 group. This adds biological support to the outcome, suggesting that BDT1 may actually shift the respiratory microbiome toward a more balanced state. And all of this happened without disturbing the participants' other treatments. The herbal formula was simply added to their existing care, and the outcome was clear. Fewer hospitalizations, reduced bacterial load, and no toxicity. So what does this mean in the context of elderly care? It means that we now have clinical evidence showing that traditional herbal medicine, when formulated carefully and tested rigorously, can offer significant protection against one of the most deadly infections in older adults. It suggests that nursing homes and long-term care facilities could begin incorporating herbal protocols like BDT1 as a safe adjunct to conventional care. It also challenges the idea that only pharmaceuticals have a place in serious preventive medicine. This was not a vitamin, not a supplement trend. This was a peer-reviewed, clinically tested formula with measurable benefits. But before we get too excited, let's talk about what this study doesn't tell us and what future research needs to address. First, this was a relatively small study. These participants across a specific demographic, elderly residents in Taiwan. We don't yet know how BDT1 would perform in other populations, such as seniors in Western countries, individuals living independently, or those with different comorbidities. Second, this study lasted a total of about 9 months, including follow-up. That's excellent for showing short to mid-term benefits, but we need long-term data to understand if the protective effects hold up over a full year or more. Third, BDT1 was manufactured under strict conditions, using standardized extracts. It's unlikely that someone could replicate this effect by loosely boiling herbs at home without precision, sourcing control, and dosing consistency. And finally, while the study monitored some basic safety markers like liver and kidney function, it did not explore herb-drug interactions in depth. That would be a critical next step, especially for elderly patients who are often on multiple medications for heart, blood sugar, and mood regulation. Still, the implications are powerful. What if every nursing home had the option to offer herbal pneumonia prevention for their residents, monitored, tested, and backed by clinical evidence? How many hospitalizations could be avoided? How many lives could be saved? Let's not forget that hospitalization isn't just costly, it's traumatic. Older adults who are hospitalized for pneumonia often face a long recovery, reduced mobility, and a higher risk of secondary infections or complications like blood clots or bed sores. Preventing that hospitalization in the first place isn't just about cost savings, it's about preserving quality of life, independence, and dignity in aging. And let's talk about the bigger picture. This study is part of a growing body of evidence showing that traditional medicine, especially formulas with a long history of use, deserve a place in modern care. For decades, Western medicine often dismissed traditional remedies as unscientific or unproven. But that's starting to change. We're seeing more studies exploring the real impact of botanicals, fermented foods, and ancient practices, not as replacements for science, but as extensions of it. The bridge between tradition and research is being built, one study at a time. And this isn't just about herbs. It's about rethinking what healthcare can look like, especially as populations age. Do we want to keep reacting to illness with stronger and stronger drugs? Or can we shift our model to one of prevention, resilience, and integration? This study points in the latter direction. It shows that using time-tested herbal wisdom combined with modern science may be one of the most powerful strategies we have. Now let's address something that viewers may be wondering. Can you get this formula yourself? As of now, BDT1 is not a widely available commercial product. It was created specifically for this trial using high-grade, standardized herbal extracts. However, Banxia Houpo Tang and Chuan Tang are both available in many traditional medicine pharmacies. But again, dosage, sourcing, and professional supervision matter. If you're considering herbal therapy for respiratory support, especially for an elderly loved one, consult a licensed herbalist or integrative physician, and always discuss it with the person's primary care provider to check for possible interactions. This is not about self-treatment. This is about informed, supervised care that respects both the individual and the science. So where do we go from here? Future studies could explore how BDT1 performs in Western healthcare settings across broader age groups and with different strains of pneumonia-causing bacteria. They could also explore its use alongside vaccines to see if the combination leads to even better protection. There's even potential to evaluate whether this formula could be modified to support people with long COVID, respiratory issues, chronic bronchitis, or asthma. Conditions where airway inflammation and mucus buildup are ongoing concerns. What this study has done is open the door. It's shown the medical world that herbal prevention is not only possible, it's measurable, replicable, and safe when done right. And that's worth paying attention to. If you're passionate about research-backed natural health like this, you're in the right place. Rooted in research, health exists to help translate clinical findings into clear, actionable understanding, especially when it comes to remedies with real historical and biological depth. Have you used Chinese herbal medicine before? Do you think studies like this could help integrate traditional medicine into hospitals and elder care programs? Share your thoughts below. I'd love to hear your experience and insight. If this video gave you something to think about, hit the like button, subscribe to Rooted in Research Health, and turn on notifications. That helps support the channel and ensures you see our upcoming videos. In the next episodes, we'll break down the latest studies on apple cider vinegar and blood sugar regulation, medicinal mushrooms in cancer and immune support, and how timing your nutrition may be more powerful than changing what you eat. Thank you for watching. And remember, when it comes to health, tradition, and science, don't have to be opposites. Sometimes they're stronger together.